Hey, what's up guys? Greenwich contractor. You know, I'm not always on a job site. I have a life, you know. I'm at the doctor right now. A lot of you Greenwich people probably drive by this sign in this building and wonder what goes on in this building. And I'll tell you, when I'm not working on your house, I'm neglecting my own housekeeping. I'm talking about home maintenance. I don't mean my actual home. I'm talking about my temple, my body. It's part of the collateral damage to this industry is just wear and tear. And I'm 20 years in and I have all kinds of joint issues and I neglect it. Actually, a lot of the neglect came from my youth. I was too young to do anything about it. I'm 45 now. I'm at that age now where the doctor will do a full knee replacement and they're treating me here for my knees. I had a hip replacement 4 years ago, full hip. Everything's healed, everything works well. But the knee, I just have been putting off. So if any of you know this facility here, if you don't know it, get inside. There's a lot of good things happening. But one of the little hidden secrets of Peak Wellness is their physical therapy operation. It's up on the second floor and they have phenomenal staff. I'm here to what I'm calling pre-T. We're doing pre-therapy before my surgery. I'm gonna have a knee replacement in December. So we're trying to strengthen all the muscles that have been really neglected and starting to shut down because the knee is so bad. The staff here is great. I'm going to take you inside and show you around and see to let you get a peek at what I'm doing. We're going to actually document my knee replacement best we can, and then of course the rehab after, because it's really going to cut into my business and affect everybody around me. So here we are, Peak Wellness. If you don't know it, you're about to find out.
Frank's got a lot of cartilage damage, pretty loose in his knee from playing rugby all those years as well. Lots of inflammation in the knee. His kneecap catches all the time just because he's overusing this muscle. So our job is just get some blood flow in there, decrease some muscle tightness in the back, help out his gait, how he walks, strengthen up the muscles the best we can so he's not shutting down, and get him ready for surgery so that when he gets out of there, he can just be flying. I got no reservations that he's going to be an all-star post. She got a little poster child for knee replacements. I got no issue with that. He's looking great. Every once in a while he'll bang it up bad, comes in, takes about a week or two to get it back moving properly, and we're flying. So we're a physician-owned wellness clinic. Dr. Carlon Colker owns the practice. He's an internal medicine and functional doctor, so we get a wide variety of high school kids, people in Greenwich, we get people who come up from the city, we get a lot of actors, and a lot of athletes coming through here. We do at the venue services. We also provide out of venue, so in-home care for people who need it. For instance, I'll see a CEO later tonight. I also saw somebody who lives in Greenwich who's just got a herniated disc, so I was there seeing her, getting her up and moving. So we're a little all over the place. We offer aesthetics, so Botox and fillers as well. We bring in a physician who works out in LA, who does a lot of celebrities out there. He's here 1 week a month, and we got 3 PTs on staff, 2 internal medicine doctors, couple nurses. We do a drip lounge, IV lounge, anything from peak performance, super hydrating, to administering medications through IV as well. So we're certainly busy. We are rolling.
I should also add that when I first came in and saw Dr. Colker, who's amazing by the way, you know, the knee was a mess, but there's all this incidental stuff. When you're not moving well, you don't really want to move because I'm in a lot of pain. When I'm in a lot of pain and I don't want to move, I'm relatively sedentary, and when I'm sedentary, I start putting weight on. So I had put on some weight. It was affecting my back. I have low back issues, and Dr. Colker beat me up good and said, dude, you got to cut some weight. So I was able to drop about 18 pounds with his help, in addition to working on the knee. So there's a lot of good stuff going on here. I'm very happy. And, you know, if you don't know what this place is about, pop your head in here.
So he's got a lot of cartilage damage specifically underneath the kneecap, and all that cartilage along with the top of the tibial plateau, that's worn down. So cartilage should be nice and shiny on a film or an x-ray or a scope if they put a camera in there. And basically his is all red and kind of decaying almost. So that's not going to get better. Even stem cells have proven to just be okay and temporary, like a Band-Aid. So really he's going to need a knee replacement. Coming up here. Knee replacement will just basically give him new coverings to underneath the kneecap, the top of the tibia, and potentially even the bottom, but I'm assuming that those are going to be okay. Surgery for that's usually, you know, it's about a 4 to 6 month rehab period with really changes happening all the way up to a year. I think Frank's going to be back and rolling no problem in like 3.5. He'll cut that a little short because he's doing all the right things by doing his prehab. So, you know, it's just not the knee. We got to work on the hip. We got to think about the low back, the opposite hip as well. So we like to take a full approach to what we're doing here. I will be PTing him after the surgery. So the way we like to operate, I'm a doctorate of physical therapist, a certified athletic trainer, and a strength and conditioning specialist. So I like to kind of take all three of those principles and work with my people. So right after we'll be PT, and then we'll get him back into athletics. Frank likes playing a little tennis and golf, so we got to get him back on the range and the course. I'd like to play with you a little bit once that happens.
Walk.
And you know, get him back to just living his life. You got a little girl, you got a couple kids. You know, we want to be able to play with those kids and keep up with them. And I think that was the big driver of you coming in and wanting to get this taken care of. So he's doing all the right things by coming in early, getting a nice prehab, so a bunch of sessions in before the surgery to strengthen everything up. If you do that, everything goes a lot smoother after the surgery. So kudos to you for...
Well, thanks. I mean, it's been a team effort. The strategy here for me as a contractor, and a lot of you guys that are watching this are contractors, in New England, we have snow, right? So February and March are my slowest months. January is when we start to wind down. So I'm getting a leg up, and I'm jump-starting the process of recovery and healing by having the surgery done the first week of December. It's going to put a cramp on my Christmas, but I'm sure it'll be fine. It's a jolly time of the year, so it's a good time to be kind of in pain, and then I'll get a jump start on healing. And my goal is by April 1st, it might not be perfect, but I'll be cruising around with Mike's help and getting things done back on the job sites.
That time frame's no problem.
Cool.
There. Crazy.
Crippled Frank.
Bulgarian.
In here, anytime I'm laying on my back relaxing, it's comfortable in here. Mike will work you. So if you guys can learn one thing from me, it's work smarter and not harder. You don't need to kill yourself to do this. You don't need to wear yourself out. And I'm not saying wear others out, but work smart and build a team and spread the pain. You don't have to put it all on your own shoulders.
We're moving through the night like we're from a different star, flying over streets and our broken hearts. But they can't even touch us, we found a different beat. Paradise is waiting and we bought the leads. Oh, getting caught in the mist, there's so many that never get out of. They're feeding the fears and the doubts. Ooh, but we're golden, we run to the end and we run without shame. We own the game, and we ride on the flames till the morning light. Baby, 'cause we're dynamite. Ain't nobody gonna hold us down. Break all the rules, let them run and hide. Baby, 'cause we're see. And we're holding the key, yeah, we're tight as can be. We're rolling, just like we please. Ooh, getting caught in the mist is a minute they never get out of. We're feeding the fears and the doubts. Ooh, but we go the way run to the end and we run without shame. We own the game, and we ride on the flames till the morning light, baby, 'cause we're dynamite. Ain't nobody gonna hold us down. Break all the rules, let them run and hide, baby, 'cause we're dynamite. Gonna let the world know. Gonna let the world know.
Gotta reach that edge.
Mike Dekens. Call Mike Dekens.